And you can see the Desmaze detachment very clearly now. Now from the other side, I fixed a trocar AC maintainer. Okay, now I'm getting air continuously inside the eye to push my Desmaze back. I closed up that incision and made a fresh incision. Now I'm doing phacoemulsification, and watch, my assistant is using an endometer for me to see better. Now, as I'm removing the last pieces, the Desmaze is fluttering and coming towards my phaco probe. Now, here I made a mistake. I pull out. And when you pulled out, the Desmaze came with it. The previous surgeon had just created a Desmaze detachment. I have removed the whole Desmaze itself. Now, once that's done, now let's move to the next problem which I'm facing. I put my 3-piece IOL. Once that's there, I thought, let me do the 4th row pupillasty, and I'll be able to go home immediately. So I'm doing the 4th row pupillasty, but the problem here is, as I do more of the 4th row pupillasty, I thought, let me remove this cortex a little bit and do some vitrectomy for the pupillary edges. In the bargain, what I've done is, somewhere my IA probe got caught to the capsule. And when it got caught to the capsule, the lens decentered. When the lens decentered, I know I'm in trouble. So now what do? I made my flaps. Now I've already done a pinhole pupillasty. So now I'm going to redo it. That means I have to break my pinhole. So now how do? Use my iris hooks. Once that's done, I next do a cleaning up of all the mess which is present there. Once I'm inside there, I'm anyway going to do a glued IOL, so might as well clear up all the mess. So you see, I'm just doing a vitrectomy, clearing up all the mess. Now I'll do a handshake technique. So here you see I'm catching the haptic. Anywhere you catch it, doesn't matter where you catch it. Then transfer it from one hand to the other till you see the tip of the haptic. Pull out. Once you have pulled out, now you do the same on the other side. So here you see now I'm catching the haptic here. Anywhere. Doesn't matter where you do. Now do the handshake technique, catch the tip and pull out. Once my both haptics are out, then I'm very comfortable. So now what I do is tuck the haptics into the chariot's pocket. And here you can see I'm doing that. Once that's done, now I'll have to work on my pupil again. So here you notice, again I'm doing a single pass, 4th row pupiloplasty. The problem here is, look at the mistake I've done. From this side, the needle went through corneal tissue, not through the paracentesis. So the whole iris has got pulled this side to one side. I had to cut the suture back again. And the bargain, because I had to do it, I have created an iridiolysis. The previous surgeon just had a Desmaze. I have not only created a PC rupture, then I did a glued IOL. I removed the whole Desmaze. I now have created an iridiolysis also. So this is the trocar-assisted iridiolysis, where you're fixing a trocar right opposite it. Here you see right opposite the iridiolysis. Now take a double-armed needle. So here you see one needle goes out here. Now this is the double-arm proline, which will go through the trocar on one side, then go through from the other side and pull this way and suture it. So here you see I pulled it. As I told you before, by this technique, when you do the trocar-assisted iridiolysis, the whole iris will get pulled to one side. Combine it with the 4th row so that you get the 2-fold technique working. Here you can see now this is the 2-fold technique. So once I've done the trocar-assisted iridiolysis, I will do the single pass 4th row pupillasty. Watch the Purkinje image now, and you'll see now it's banged on the iris a little bit. So at that stage, go in with your vitrectomy probe so that you have a good pupil there. Now you notice the Purkinje image, bang center. That's the key factor. Once that's done, case not over. Remember, I remove the whole entire Desmaze. Okay, so I do the PDEC. This is called the pre-Desmaze endothelial keratoplasty because we use the young donors only. And once I've created this graft, we inject the graft inside, and let's see how this patient behaved now at the end of the day. So that's how the patient looks at the end of the day. Apply the fibrin glue. So now let's see the pre-op, post-op, and you can see here, pre-op, anterior segment OCT on tape before the surgery, showing the nucleus and the Desmaze, and final post-op, 1 week, patient's vision improved to 6/9. Saying that, ladies and gentlemen, I'd like to thank all of you for coming for this session. If you have any doubts, please feel free to ask me, because we'll be finishing this session at 12:15 sharp. Thank you very much, all of you. 100%.